Intensive care has changed a lot in the 20 years since I started doing this. We're dealing with kids who are much sicker because they're getting out of the neonatal intensive care unit and they're sick. We're dealing with kids that used to die at the scene of car accidents don't die anymore. They get to the hospital. We got to deal with it. And same with some of the other stuff we have to deal with. So it's not easy. And they're getting sicker all the time. Okay, so we've got to be on top of our game. We've got to know what we're doing and where we're going and where we're going to go there. Okay, so that means equal pay for equal work. Okay, how do you define equal pay for equal work? Lord only knows. But let's say that it's not based on the two-tier system that the government designed about 18 months ago. All of us were very surprised when that came out. Can't really explain where it came out. We don't begrudge our oncology and pathology colleagues who also have difficult jobs and long hours. But why did the government leave it be? That should have been changed back. All areas of medicine are equally important. Cancer kids are not any more important than kids with seizures, okay? The list is endless of what kids can get into, what kids can get sick with, and what we have to deal with. And it's unfortunate that we don't have an equality system within it, okay? I resigned on November the 5th, further through to February, and it was the hardest decision I ever had to make in my life, to sit down and actually write my name on a piece of paper that said, I quit, or I resign. We've tried meetings, we've tried letters, we've tried people being advocates for us, et cetera, and we're not getting anywhere. We only hope, or we do hope, for a resolution of this mess in the very near future and for a truly comprehensive effort to solve these serious issues of recruitment and retention. I sat down and wrote, I know you hate people reading to you, but okay. To recruit physicians, the Department of Health must be competitive to the rest of Canada, who, vis-a-vis salaries, the service, ICU service, must provide sustainable service through retention of specialties, because it can only be done with appropriate resuscitation or appropriate remuneration. We must be paid in the same range as the rest of our buddies are. I didn't swear too much.
Thank you. And our final speaker is Dr. Christina Templeton, pediatric cardiologist.
Hi. So yes, as the other panelists have alluded to, I'm a pediatric cardiologist, and that is my primary role at the Janeway. But because we only have 2 pediatric intensive care specialists, and you can't run an intensive care unit with only 2 full-time people, I also provide evening and weekend coverage there as well. The main reason that I'm here today is to elaborate on recruitment efforts that have already taken place trying to fill this gap. The response that has been given by the government for how they're going to deal with these resignations of these physicians is that they're simply going to recruit more physicians to replace them. But the problem is recruitment has been ongoing for years and it isn't working. Specifically in the pediatric intensive care unit, we've been trying to recruit a 3rd full-time intensivist for the last year. In that period of time, every single pediatric intensive care training program in the country has been contacted to let them know of our need. All of our colleagues know that we're recruiting, and every single pediatric intensive care trainee in the country has received a personal letter inviting them to come and see our program and apply for this position. This is just to achieve a 3rd intensive care specialist. As Dr. Reid said, ideally we would like 4, but at the moment we're just focused on getting a 3rd one. In the past year, we've had 3 applicants for the position. They have all come from very reputable training programs and would have been excellent additions to the Janeway. They came to see the program and to see the unit. They come in and they see a fantastic ICU with wonderful nurses, the best you could ever ask for, in a community that gives wonderful support. We could certainly never do better than the Janeway Telethon does every year. And they come away with a great impression until they get into the nuts and bolts of what the job actually entails. And when they realize the hours that they're going to have to put in and the remuneration that they're going to receive for that, none of them have accepted the position. And so unless that situation changes, I can't imagine where these imaginary physicians are going to come from to fix this problem. So we feel that it's critical that this two-tier system be eliminated, partly from the perspective of recruiting new physicians and also for retaining the physicians that are already here. And I will say that I'm not saying this for my own benefit because I'm not a salaried physician. I'm fee-for-service. This is not going into my back pocket. We need this for the quality of care that can be provided to the children of Newfoundland and Labrador. And we'd be happy to take your questions at this point.
Dr. Buckley, can you tell us what level of care or what quality level of care you'll be able to provide at the Janeway should these, I think it's 6 or is it 7 pediatricians of some sort who have decided to leave, if they're allowed to go?
Yes. Well, I can speak primarily for my department. There's 3 doctors, 2 pediatric neurologists and a pediatrician working in the department. 2 of those going leaves me in the position to see all those patients. It's not tenable for me to see everybody that they've been seeing. So either the waiting list just get extraordinarily long, or I only see the acute ones.
So moderate patients, children with moderate conditions, for instance, who wouldn't be considered urgent or emergent, they just wouldn't be seen, or how long would they have to wait?
Well, the CMPA suggests that if I can't see them within 6 months, I should send the letters back to the referring physicians. At the present time, my waiting list is at 6 months. So to take on the work of those other 2 is just untenable.
Dr. Templeton, you talked about the recruiting efforts that have been ongoing. I mean, this was similar to what we heard about disciplines such as oncology and pathology prior to the Premier's intervention in 2008. Do you think if you increase the base salary, you'd be able to attract the critical mass that you need?
I think that physicians make decisions about employment the same way everybody else does. It doesn't matter if you're a teacher or an electrician or anything else. If you're lucky enough to have more than one job offer in front of you, you make a basic decision based on how much work you're going to have to do and how much you're going to have to, what you're going to get paid for it. So if you have one offer that is more work but it's also a reasonable amount of money, then that may be a little more attractive. If you have one that's less money but it's also less work, then great. If you have an offer on the table that's more work for less money, nobody's going to take that. It doesn't matter what job you're in.
But the situation right now, I mean, it's a fairly new hospital, I guess, in the world of medicine. Mm-hmm. As you mentioned, you do have supports with things like the telethon, but can you be competitive with the salary and work instead of being offered now? Can you be competitive at all?
The only way that I can answer that is it worked for oncology and pathology. Those 2 services are now fully staffed.
What do you make of the government's reluctance or unwillingness to offer the same pay scale to other medical specialists? What do you think of that position?
Well, it's really disappointing. It was such a beautiful fix for the problem the first time around. I don't know why it isn't then natural for it to give the same response the second time around. I think that it's quite disrespectful towards my colleagues to suggest that they're not working as hard or that their work is not as valuable as the oncologists and pathologists. And I think that there is the opportunity here for the government to make a huge gain in healthcare in Newfoundland and Labrador, especially having proven by their own system that this can be successful and that we can have a fully staffed oncology and pathology service by offering remuneration that is above Atlantic parity to take account of the fact that the workloads are so high.